Good morning. My name is Cindy Grush. I'm the clinical educator for the Vascular Center of Colorado, and we're here today to talk about the drainage tube that was placed and the care and flushing of that tube. Within the last couple of days, you had a drainage tube placed in either your kidney, your gallbladder, or your liver. And the interventional radiologist is going to provide you with an instruction booklet that we're going to refer to several times this morning in our demonstration. As you see, this instruction booklet was written by Dr. Clunan, and if you look on page 4, it will guide you to some of the things that you're going to be taking home with you. For sure, you're going to be taking home your instruction booklet. You're also going to be taking home with you a patient care kit, and in this has some of the items that you will be using when you go home and when you're discharged. Also, these items in this bag, which I have displayed over here, are a cap, some alcohol wipes, some tape, and some flushes for your tube, and also some dressing changes. Once you get home, these supplies are going to, you're going to use them all up. So we provide you also with a prescription so that you can have this filled before you leave the hospital, and then you'll have these items with you so you don't have to run back out to the drugstore once you get home. So in caring for your tube, if you look at your booklet, it gives you all of the directions that you're going to need. And it's all located on page 5 on flushing. The first thing you're going to do is to make sure that you wash your hands with warm soapy water. You're going to put on some of your exam gloves that you have or that you've gotten from your local drugstore. And your tube may be placed in a different location. So it's actually possible that your tube will be coming from your back, in which case you may need someone to help you care for that tube. This one we have on display today is actually going into this patient's gallbladder, and so we have it here at their side, okay? Your tube is going to come two ways. It's either going to have a little cap on the end of it, or it will be connected to a drainage bag. When you're getting ready to flush this, what I'd like you to do is take the plastic outer wrapping off of your syringe, lay it on your surface, it'll be ready to use. Now let's begin the flushing process. After you've washed your hands and put your gloves on, you're going to take your catheter and you are going to disconnect it. All right? You are then going to grab an alcohol swab and cleanse for 15 seconds. We won't be doing the full 15 seconds today for this demonstration. Then you're going to grab your syringe, twist off the white cap, connect it by threading. All right, you get a nice snug fit. Then you're going to depress the plunger and the fluid inside into the body all the way down, remembering never to pull back on the plunger. Once it's depressed, you will then disconnect, grab another alcohol swab, again clean for the 15 seconds, and then reconnect your tubing. Now, there are times where this little tiny wire here might get in the way of the threads, so just make sure that it goes to the center of your connection and then screw it together. That's all there is to flushing. You don't ever push back on your plunger. Remember, depress the plunger, put all of the fluid into the body, disconnect, clean it, and reconnect it to your drainage system. The last couple of things, once you take your gloves off and put them in the trash, you'll again wash your hands with warm soapy water, and then you'll be all done and you can discard your supplies. The two important things I want you to notice about the booklet are page 8. These are the specific instructions written from your doctor of how to care for your tube. He may have you cap it, he may have you put a drainage bag on it, he may have you flush it, he may have you not flush it. So all of those instructions are personal to you. The last page is page 9, and it has all the troubleshooting tips. So if you have any questions or anything that comes up once you get home, all you need to do is call the phone numbers on the back of the pamphlet.